I was at cheer practice and I was coming down from a stunt called a peg leg, and what you do is you land on one leg, and I had locked my leg out, and when I locked my leg out I landed straight on my leg and it kind of buckled underneath me, and that's when I kind of heard a pop, and that was when I tore my ACL.
The ACL is one of the stabilizing ligaments of the knee. What the ACL does is it stops the tibia, the shin bone, from sliding forward. So in certain injuries, usually contact injuries, but oftentimes non-contact, twisting type injuries, the torque that's applied on the knee can be so much that it ruptures the ACL, it tears the ACL.
My first visit with Dr. Greenfield, he saw fluid in my leg, and that was one of the telltale signs of a torn ligament. And he wanted me to go get an MRI, and I got the MRI done that day. It was very quick. The results of the MRI was that I had a torn ACL and that I had a medial meniscus tear in my left leg, and that I would need surgery very soon.
Repairing the ACL can be done in children and younger kids who may have just pulled the piece of bone off. But in older patients, and we'll say older or teenagers and above, it's oftentimes necessary to reconstruct that ligament. Basically to take tissue from somewhere else, whether it's somewhere else on that person's body or whether it's a donor graft, put that in to reconstruct or replace the ACL. And in doing that, we can restore their function, restore their stability, and improve their long-term longevity in their knee.
Me and my family decided that the best option for me was to go ahead and get the surgery because Dr. Greenfield had explained that I would have issues walking later on in life, and I didn't want to experience that, and we thought it was better to go ahead and just fix it now. Today I feel great. I can do whatever I want to do. I can do gymnastics, I can run, I can go exercise with my friends, and I never have problems with my knee, and if I do, I can just put on my knee brace and that takes care of all the issues.